Hey everybody, it's Dr. Joe, and today I'm going to show you how to use a TENS EMS unit for knee pain relief. So let's get started.
Disclaimer alert, disclaimer alert.
And before we get started, if you haven't already, make sure and click on the subscribe button down there because it helps my channel grow. So I'm going to use the iRelieve wireless EMS TENS unit for this, and I'll talk about it a little bit more later. Let's jump on into relieving knee pain with TENS and EMS. So TENS stands for transcutaneous electrical nerve stimulation, and this is mainly for pain control. This is not trying to get the muscle stronger. This is to kind of relieve that pain, help increase the circulation for healing. EMS is electrical muscle stimulation, and sometimes it has different names depending on the units. The ones we use in the clinic is a neuromuscular electrical stimulation device, but it's really just you're trying to get the muscle to work again. You're retraining it. But these are not going to bulk up your muscles. If you're looking to bulk up muscles, it never is really going to be able to contract the muscle more than you can yourself. So this is really for a retraining purpose. If you've had an injury or if you've had a surgery and you're approved by your doctor or physical therapist to use it, that helps retrain that muscle that's maybe kind of shut off or not quite activating like it's supposed to after that surgery or that injury. And a lot of times it's the quad. So I'm going to focus on the EMS portion of strengthening, but I'll show you a little bit about the TENS, for the pain control as well. So with the EMS going on the quad muscle, if you were in a clinic, we'd probably be a little more specific, maybe trying to get the medial quad or the lateral quad, depending on what it is. In the full technical world, they take little probes to find exactly where those muscle activations are and then put the electrodes on it. You want to be a little more specific with an EMS versus a TENS, but you don't have to be right on. You can do a little trial and error where you put it on. If you're not quite getting that contraction you need and you're getting to a point where the electrical stimulation is just hurting and you're still not contracting, I always say turn it off and just move it around a little bit in a couple different places and you might hit that right spot. So what I want to show you is with the iRelieve TENS EMS wireless unit, and some of my favorite things about this is the biggest one is that it's wireless. So it's not going to do anything crazy different than a traditional TENS EMS unit, but there's no wires that are all over the place, so it makes it super functional, especially with the TENS unit, because if you want to put it on for that pain control and then continue to do stuff throughout your day, you can do that. So I really like the wireless component. I also like that they have these big pads on here. So if I'm trying to get that quad, sometimes with the smaller ones, you can use two to get to the spots, but see, they have these here, so it covers a large area, so you're really going to get that nice contraction. It also has 14 different programs on it, so it has for pain relief, arthritis pain, and muscle conditioning or recovery is what I would more likely call it. And it's also rechargeable, so you don't have to keep getting batteries. You can charge it in a wall and then keep using it, so it makes it really nice. So if I want to strengthen my quad here, so if you've had an injury or surgery, you might not see it contract. You might go, I'm contracting it and not much is happening like that. So I would put this a little bit more on the inside. Like I said, you might have to play around with it a little bit, but that middle, the medial quad, which is your VMO, is the one I like personally to try and activate. So when you're starting this, make sure you turn what they would call their pod part on, and then turn this on so you can see that it has the wireless activation. That means that they're connected, because it won't really let you do a whole lot until they connect. If I was going to do a quad set where I'm trying to activate my muscle, but I'm using this to help it, most of the time I'd take like a rolled up towel or a pool noodle just to put under it, because you might not have a whole lot of squeeze, and that's going to help you push down to help activate that quad muscle. So I'm going to use just the first EMS setting, because that one is the one that I personally like to get the contraction the best. But again, when there's different settings, everyone's different. Mine, what works best for me might not work best for you. So I always say, just try it or take it when you go to physical therapy and have your physical therapist help you figure out which one is the best for you. So once you get it on and you get everything set, you can set the timer here and then the intensity, then I'm just going to start taking it up. So it blinks when you're setting it, and then once you have everything set, it's not blinking anymore, and that's when you can start doing the increasing the intensity. So what I'm going to do is I'm just going to start increasing it first. I usually say pretty quickly until I start feeling something. Because sometimes if your muscle is kind of weak and it's not activating, you might not feel anything right away. You want it to be strong, almost to the verge of not comfortable, but you want to start getting a contraction. So see, I'm not doing anything, and I'm going to keep bumping it up a little bit. And now I'm starting to get a little bit of a contraction. And you can see when it lets go, it kind of jumps down, away. But I usually tell people, go till you're like, I don't want it to go anymore, and then really try and go 1 or 2 more. So you're really getting that contraction. And if you're using it as an exercise, while I'm contracting, I'm pushing down into that quad set. I'm trying to activate it. And then when it stops, I stop. And then I'm going back in. I'm not lifting that heel. I'm keeping the heel down, and I'm trying to push everything into it. So since this is really helping retrain the muscle too, a lot of times you don't have to go any more than 5, maybe 8 minutes. I wouldn't go for the EMS much longer than that, because you're going to fatigue that muscle. That's okay. It's okay to fatigue the muscle, but you really want to make sure that you're not over fatiguing that muscle. So once you get all that done, if you're just looking maybe more for TENS, then you can either use the 1 channel or you can use 2 channels, because with iRelieve, it actually comes with another pod where you can maybe spread it out a little bit. You don't have to, but sometimes if the whole knee is hurting, you might want to do 1 on top here and then 1 below, so you're kind of getting that whole area. You don't really want to put it on bony areas. You want to give it a little bit more on the muscular areas, the meaty areas. But you can just do 1. So maybe my pain is still up here around in the quad tendon area, or just in the quad muscle itself. So I would then change the setting to the TENS. And then once I get to that, I would just start slowly taking it up. And you can see it blinks a little bit when I take it up, so you can see that it's going. Now with the TENS for pain control, it really shouldn't make that sustained contraction. It might flutter, the muscle might flutter a little bit, but usually with the TENS, most of the time, you don't want to see a contraction, because this is for pain control. You want it to be comfortable. You want it to calm everything back down. Get that inflammation out by increasing the circulation, and this is to make you feel good. So again, run through the settings when you have your TENS unit, because what might feel good for me and what I feel like is the best for me might not be the best for you. So you might have a therapist say, I want you to use this specific setting, which is fine, but what I usually tell my patients is go through each setting and just pick the one that you feel is best, because that's what it's for pain control. So for this one, again, like I said, you shouldn't really have that contraction. If it contracts a little bit, like some of them, like the acupuncture setting, it's going to do a little bouncing in, you're going to get a little contraction. But as long as it's not holding that contraction, you don't want that hold in there. So a little bit of flutter is okay. So this one you can do a little bit longer. I usually recommend anywhere from 15 to 30 minutes, really just depending on what you're working on. So if you have a wired unit, which iRelieve also has, for the TENS, you can have 4 electrodes versus the wireless, 2 electrodes would be in 1 pad. So this would be 1 channel, 2 electrodes. This would be 1 channel, and this would be 1 channel. So 2 channels with 4 electrodes. And so it sounds a little bit confusing, but usually with the wireless ones, you have your 2 electrodes that are kind of connected together, which would be 1 channel. So if you have it wired, often for the TENS unit, not for the EMS, you would have 4 electrodes. So you can do it a couple different ways, because you can just use 2 electrodes, which would be 1 channel, or the 2 channels for 4. The biggest thing to know with the 4 electrodes is if you're doing that TENS and you want to get maybe the whole knee, your whole knee is bothering you, each channel has the 2 electrodes and you want them to cross. So there'd be here and then here. And so you don't want them really to go this way, and you don't want them to go this way. You want those currents to cross each other really to get the whole knee covered. If you don't, that's okay. It's not going to make it not work or anything, but it's just going to not get as much of a benefit if you don't cross it. So you want to make sure and cross it. So for example, let's say these 2 electrodes were channel number 1. I would want to put it here and then cross over to the other side, and these 2 electrodes would be channel 2. So then I would cross it here and then here. So again, these two would be talking to each other and these two would be talking to each other. So you have that cross pattern just to get the most benefit out of the TENS current going on. So if you're using these wired ones for EMS, then you would just usually want to use the 2 electrodes, which is 1 channel. So kind of like, again, this is the big 1 channel of the 2 electrodes where I just placed on top here. This time I'd still have the 1 channel with 2 electrodes, but I'd probably fit it more if I'm looking to get that medial quad in there. I'd place it here and then maybe right here. Some people would place it more this way. You could do it that way. But again, you might want to just play around with it a little bit because you want to follow that muscle belly or the fibers. So they're contracting that whole muscle belly together. So that's kind of how you want to work. And again, sometimes I might have it on and it's not feeling quite right. So I'd pause it and then maybe I'd have to move it even a little bit more outwards to get it, or maybe move this one a little bit more in and then that one even further in to get that contraction. So it is kind of a learning curve because everyone's so different. But again, once you find the spots that work for you, then you know you can go back to those spots while you're retraining that muscle. So if you're interested in purchasing the unit, make sure and click on the link up there. And remember, be safe, have fun, and I hope you feel better soon.